I'm going to hand you back to Colin now.
Okay, thanks very much. And so hopefully you're saying that really from Casenotes' perspective, one of the big success factors for us was getting that very tight level of integration with the actual user teams on the ground, so with the clinicians, really helping us at all stages of the project, right the way through from inception, through to design, through to implementation, and great feedback during the model office, and it's all been massively helpful. So for those of you who are looking at putting in really any system, not just EDM, I can't stress enough from the actual perspective of the supplier how useful it was to have a very competent but also very keen user group. It was absolutely fantastic within Ipswich. And so Ipswich, when it went live, it was called EDITH, and it's now called Evolve. So let's have a quick look at really what's changed in that time. So EDITH was the initial version of Evolve, and as hopefully has been coming across, created in close conjunction. And as I said earlier, it was a relatively short turnaround period. So from the start of the project back in May 2009, we went live 6 months later, design, implementation, rollout, user acceptance, the works. EDITH standing for Electronic Documents Integrated for Total Healthcare. And at that stage, it was really the core document viewing experience, the ability to annotate those documents, the start really of aggregation of data from various feeds, so bringing in, for example, a pathology feed, electronic discharge, which we'll talk about and come across later, and then also the user generation of letters for a particular patient, for example, a letter back to the GP. We actually had a name, I've just been reminded, we actually had a name the system competition, and that's where EDITH came from. And again, it's all just about end user buy-in and just getting support from your user community and ownership from that community. And so this is what EDITH originally looked like. And so it's really that core ability to, on the left-hand side, have tabs and have your documents very similar to the actual standard physical patient case note that you would have, with then your main document viewer with thumbnails to multiple pages, the ability to then create draft documents and letters, and also we built in some discharge functionality. Now, discharge functionality wasn't part of the original tender, it wasn't part of the original project, but it's something that Ipswich had a challenge with, and so they came to us and said, well, as well as the core electronic document management, can you also look at bringing this in as well? And I think it really stands as testament to the flexibility of Casenotes' approach that we were able to then start designing in additional components really from the start, and we've certainly kept that up, and we've been able to deliver, though, as well as the core EDM, we've also been able to deliver those additional modules within the project timescales as well. So what does it look like now, moving from EDITH? So we had originally that very much a generated or the scanned discharge letter. With the introduction of the electronic discharge, we're now much more onto much more, well, pleasant to read because you're not reading scrolled handwriting, no offense to it. But also it's all on the screen, and the ability to also send that back to the GP through their mechanism of choice. So for some GPs, they want to have it sent out automatically as a letter. For some GPs, they can accept it as an encrypted, protected email. And for some GPs, we can also send that directly into their systems. So we've actually worked with Connecting for Help on the interoperability toolkit to show that we can actually help to meet the 24-hour targets. And currently we're sitting at more than 85% of all of the discharges are going back to the GPs on time, so very much helping to protect revenue in the trust as well. So Evolve then is really the productization of that initial EDITH platform, if you like. It's also taking EDITH towards a more portal-like experience. So, for example, we've added in a list screen where we can search based upon, well, what clinic is the person in, what consultant are they under, what ward are they in, and the addition of electronic forms and workflow to start really looking at process management and process enhancement, and a user configurable dashboard so that as a user I can choose to see the search screen, I can choose to see certain lists all within the one place. And so this is what it looks like. So it is similar in some areas We've still got those lists of documents and the main documents. Obviously, some nice new branding brought in there. But then the additional areas, hopefully, will be plain to see. So we've got the new dashboard area, where I can do searches on the left-hand side. I can see my list of workflow items, so my task list on the right-hand side. We've got the list screen to allow me to search by consultant, by clinic, by ward, etc. And again, it's all just different ways of allowing the user to very quickly access the information that makes most sense to them. We've had very positive feedback about our list screen, just in terms of it makes it so quick and easy just to jump directly to the patient within the proper context. And Damien sitting beside me very much nodding his head from a diabetes clinic perspective as well. We've got then for a user, here's everything that you've been sent. So here's various administration requests, or if it was a referral request. We have also started looking at reports, and Damien will cover in a minute. The ability to bring up, for example, a diabetes trend report to see, well, who's reporting with type 1, who's reporting with type 2, what is the blood pressure level for this patient. The trust can then create these reports and also can create their own workflow themselves. So one of the big uniques for us is the ability for a trust to take the workflow designers, to take the workflow that we ship with, to modify them as they see fit, and really to start going into new departments, creating up the workflow processes and also the forms, and to track those workflows. And it really starts to then support a QUIP process and really the process improvement. And so you've got your form designer here. And so it means that a trust is very much in control of its own destiny. They can go into the department, identify some processes, identify some forms, create them themselves in a relatively short period of time, start to go live with a basic solution, do some testing with the users, get feedback, make some iterative changes, and then very quickly put that live. And it's really, in some cases, it's almost the opposite of what the national programme was, where they were waiting for a long time for a very monolithic solution that they had very little control over. Trusts can now really iteratively develop their own care pathways, for example.